And I want to welcome everybody who came today. It's such a pretty day, and we'll just take an hour out of your pretty day to spend some time here with Julie. So I have to put these on to see up there. First, I have to say our little spiel that comes at the beginning of each one of our talks. And that is the League of Women Voters, excuse me, never supports or oppose a political party or a candidate. We are a nonpartisan political organization encouraging informed and active participation in government. We do voter services. We have two prong. We do voter services and citizen education to inform folks about elections, voting process, and issues. And we also, though we are nonpartisan, studies are done. And once those studies are done, we use our positions to advocate for or against particular policies for public interest. Whoops. Sorry. So because of that, the comments or the opinions people might mention today are not necessarily those of the leagues, but of the individual. We'll be here from noon till 1. And I ask that everybody remain muted while Julie, our speaker, speaks. And she'll speak for a half hour-ish. And then we'll have question and answer for a half hour. And if you can put your questions or your comments down in the chat, and then I'll read them to Julie as we go, and she can answer questions as you know when we're done. Please remain muted, put it in the chat. And if you need more information about the League of Women Voters, male or female can join the League of Women Voters. And if you would like more information about them, go to lwvsouthbend.org. And they also on there, we will have there's a link there to also get to the League of Women Voters Indiana and the League of Women Voters nationally. I looked at the League of Women Voters for Indiana today, and that talks about the issues in Indiana that we're involved with and interested in and supporting. And there's a lot of information in there about what's going on in our state. So you can check that out. There are a few things that I want to mention about things that are coming up for the league. One is district debates. We've been having debates for the offices in the city. And there's one coming up on the 21st of April at 6 to 8 p.m. Candidates running for contested South Bend Common Council districts. So there will be a district debate then. Come early and then plan to stay for a network reception afterwards. It's at the Layton Auditorium, and that's at the South Bend Library on Main Street in South Bend. And it's sponsored by the American Democracy Project at IUSB, League of Women Voters of South Bend area, and the library. And it's free and it's open to the public. And they welcome folks to come and hear what the candidates have to say. Excuse me. Another thing is the Indiana League Legislative Action, the best source of league action information and issues is lwvin.org, which is the League of Women Voters for Indiana. And so you can go there to find out what's going on and how you can get involved if you wish to. Indiana legislative contact information, and this was all in a email that was sent out by Jerry. Excuse me. At iga.in.gov, and it's all about the bills and legislation committees and watch sessions. And so it's how you can get involved with your own particular district person and what they have to say and what they're involved in. And you can kind of follow them along. On the 20th of April, the league has a meetup. It's called a meetup. And it is at the Cellar Wine Bar and Kitchen. And it's for folks to just come. Since we have lunch with the league online, we never get to really see each other and talk to each other. And so this is kind of a way to get face-to-face with other folks that are in the league. Just to kind of hang out, an informal meeting from 5 to 7 on Thursday, the 20th, at the Wine Cellar Bar. And there will be parking in the rear and the adjacent. There will be light appetizers. But if you want to drink some, and if you want to eat heavier, it's on you. And invite folks to come along if they're interested in knowing what we do. RSVP for that day by the 17th to Kathy Platt. And because they need an idea of how many light refreshments to have. Is that right, Kathy? She nodded. Okay. And now, oops, sorry, there. And now I would like to introduce you to our speaker. Her name, and she is in my upper left-hand corner. I don't know. Can you wave? There you go. That's Julie. Julie Olson-Tobias. She's the director of Real Services Aging and Disability Resource Center. And Julie has her BA in sociology from Taylor University, is a certified memory care professional through the Institute of Excellence in Memory Care. She's currently attending Bethel College to earn an MA in organizational leadership. And she has led care management intake and adult guardianship services. Just a minute. I lost my place. Oh, at Real Services. She's also served at the Indiana Division of Family Resources, both as case manager and quality assurance analyst. She focuses her work on serving vulnerable populations, individuals needing public assistance for food stamps, health insurance, individuals who become incapacitated because of effects of dementia, and individuals who need an advocate to ensure they receive appropriate assistance through community resources. And so with that, I'm going to leave it to Julie to tell us a little bit more about Real Services and what they do for our community.
Good, thank you. I think I'm sharing my slideshow. Can you see it?
Yes. You might, there you go. Yep.
Thank you. So Real Services is an umbrella social services organization with 30 major programs. We're not going to go through all 30, don't worry. But what we do is support independence for life. We've been serving the community since the 60s with programming to support seniors, to support disabled individuals, and to support vulnerable families. Our website is realservices.org. There are 3 major arms in Real Services. There's the Community Action Agency. There's the Area Agency on Aging. And there's Alzheimer's and Dementia Services of Northern Indiana. And I'll speak in detail about each of these. First is the Area Agency on Aging, and that's where I fit in. The AAA, we call it, Area Agency on Aging, was designated by the governor to serve older adults and implement the Older Americans Act and related programs in the 5 counties that we serve. So we've got St. Joseph County, Elkhart, Kosciuszko, LaPorte, and Marshall County. I'm with the Aging and Disability Resource Center. We're a single coordinated system of information and access for all persons seeking long-term services and supports. Regardless of their income or their state of health, we're happy to answer questions. We provide information, referrals, and assistance with long-term planning and other aging issues. And we serve individuals with disabilities regardless of their age. We serve individuals with physical disabilities. So my youngest client was 6 months old with a physical disability. So I loved having that baby, all the way to more than 100 years old. I'm part of the Resource Center. Like I said, I'm the program director for the Resource Center. We also do home delivered meals case management here. And we have a call center, and we welcome community members to just come to the office if they want to meet with us one-on-one. We're currently located on Mishawaka Avenue, but next month we're moving back to headquarters. Our main office is on Michigan Street in South Bend, and we're really looking forward to being on Michigan Street where most of our programs are. In the Area Agency on Aging, we do health education. So we have an educator who focuses on fall prevention. We do 2 evidence-based programs. One is called A Matter of Balance, and the other is called Walking with Ease. And she does these for any organization that requests the 6-week series. Right now she's doing it at the Kroc Center and at Forever Learning. She's also available for speaking, and focuses also on nutrition for older adults. We'll talk more about our nutrition program shortly here. We do care management. So we work with 6 different funding sources that can pay for in-home care. This care can be provided for people who need a lot of care, and they are what we call meeting nursing facility level of care, where they have deficits in at least 3 activities of daily living. Activities of daily living are things like bathing, dressing, toileting, ambulating, transferring, and managing medications. If a person needs direct assistance with at least 3 of those, then they would qualify for one of our Medicaid waiver programs that waives the requirement that Medicaid dollars be spent in a nursing home and allows the person to age in their home where they're more comfortable and are going to have a higher quality of life. And we pay for the services that empower the person to stay at home. Now, if the individual wants to age in a nursing facility, we help with that too. So we do pre-admission screenings for community members who want to go to a nursing facility for their care. And we also do what's called a denial second party review. If a nursing home or a hospital does a pre-admission screening and it comes back potentially denied, then we as the Area Agency on Aging go and complete our own independent assessment and determine whether the person is denied or approved for nursing facility care. We have 77 care managers right now, and plus a few openings. So we typically need just over 80 people to meet the needs of the individuals who are getting home care. We work with not only the Medicaid waiver for the aged and disabled and the traumatic brain injury waiver, but also the Social Services Block Grant, Title III of the Older Americans Act, and CHOICE. CHOICE is an acronym, and its purpose was to provide funding for people who aren't as bad off They don't need nursing facility level of care, but they still are at risk or have a need, and we can provide home care services to meet that need. Home care services examples might be a bath aid and a homemaker, maybe adult day services, maybe structured family care where a loved one who lives with the individual provides their care. There's a lot of options in Indiana to receive care. It's pretty neat. So these care managers coordinate the services to meet the care needs of individuals and their caregivers under these state and federal programs. This program is person-centered, very person-centered, meeting the unique needs of those individuals. And we are accredited through the National Committee on Quality Assurance. We're very proud of that accreditation because it was very difficult to achieve, and we're up for review to be accredited for the next 3 years. We do options counseling in the Area Agency on Aging. Options counseling is supported decision-making. We talk with individuals about their needs. Through the conversation, all of their unmet needs get revealed. And then in a really person-centered way, we present all the options available to meet their needs and help them to sift through those options and determine what programs they're going to go with to meet their needs. Then, of course, quality assurance is an aspect of the Area Agency on Aging. The care manager's work is reviewed and sent back to the individual care manager for the care manager to fix anything that needs fixed, or contact the person if any additional information is needed. Next is our community action program. There's a lot going on with community action, same as Aging and Disability Resource Center and the Area Agency on Aging. They have financial literacy, foster grandparents, IDA, which is Individual Development Account, Team Heat, housing stability. So financial literacy, we help families become financially self-sufficient. That's the goal, because Real Service is interested in independence. So to help an individual family become financially self-sufficient, we have a star budgeter. They can go through budgeting classes. They can, but we bring bankers in that provide education. And we offer this individual development account, which is a matching account, and it's a savings, and it helps people to buy a house, buy a car, go to school, or start a small business. And we have helped individual families do all those things. We helped recently, in 2022, I know we helped someone purchase their first home, complete their master's degree, purchase a car, and start a small business. We've hit each of those. Foster grandparents is the neatest program. It provides the opportunity for low-income folks age 55 and better to provide one-on-one support to at-risk, special, and exceptional needs children. So these are older adults who accept a stipend for their service, and they go to the nursery schools and the schools and work with at-risk kids. It's a really beautiful thing, and of course it's mutually beneficial. We did a commercial last year, and we had the child saying, "Granny helps me with my reading," and then the grandma said, "And she helps me with my computer." So it's really sweet. Team Heat is a matching program too, where we can help with a little bit of a person's energy bill. It's for eligible families, we pay a matching $50 on their bill and provide counseling and self-sufficiency classes. That runs from November 1 through March 31. And then housing stability. So when COVID hit, there were new streams of funding, and people lost income because of COVID for a number of auxiliary reasons, but the root of the problem was COVID. So with this funding, we have helped with housing stability. We had a rental assistance program that helped with back rent, future rent. There's a housing stability program that can help with moving, paying deposits for utilities and the apartment, first month's, last month's rent. Really, really neat programs to help people who were affected by the COVID emergency. I promised we would talk about our nutrition programs. We're probably best known for Meals on Wheels. Meals on Wheels is, well, you can see up here, he's delivering her lunch. Every day, Monday through Friday, volunteers deliver a hot meal to individuals who are homebound. And some individuals need 2 meals a day, and they get their hot meal for lunch, and then they get like a sandwich or a salad and a piece of fruit and a milk for dinner. So these foods are nutritious, meeting 1/3 of the daily recommended nutrition for an older adult, and serves people who are homebound, unable to make an adequate meal for themselves. And I think it's really neat that meals are delivered by our dedicated volunteers. Next, I want to talk about our nutrition sites. These are congregate meal sites. We were, as far as we know, the first to develop this program in Indiana. It provides low-cost, nutritious meals with programming Monday through Friday. We in our 5 counties, we have around 20 to 30 sites going at any time, and seniors meet for their noon meal. What's really cool about this program is, again, it's the same meal that was delivered to the Meals on Wheels individuals, and so it's 1/3 of the daily recommended nutrition for an older adult. And studies show that adults who eat together tend to eat more, and so they're less risk of being malnourished. And then there's the programming. There's speakers like me go in, I talk about scams, I talk about Medicare. Our health director, our health education manager, excuse me, she goes in and promotes better health and talks about nutrition or the fall prevention programs. And just there's more pleasure derived from group participation. So I don't know about you all, but if I'm ever home alone to eat a meal, I've eaten it over the sink, not bothering to even get a plate and a fork, right? So I've just eaten that sandwich over the sink. And that's what seniors are doing. And these are seniors who can drive to the location and meet their friends for lunch every day. It's low cost. It's supported by the Older Americans Act, so it's donation only. And they can eat a good meal together and have fun with their friends. I'll tell a personal story at the end of me and nutrition sites. That's what I'll close with. There, more food. We love our food. Senior Farmers Market. It's a state program that provides a voucher for seniors who are eligible to get a voucher to go to the farmers market and get fresh produce. So they can go every week for 4 weeks and spend $5 of their voucher to get fresh produce. Also part of the Older Americans Act is transportation. Real Services ourselves provides transportation to essential errands and doctor's appointments for individuals who live in South Bend, Mishawaka, Osceola, and Granger. And then we subcontract that out to the different counties that we support. And finally, Real Friends. Real Friends became a program when COVID hit. We couldn't work in the office anymore. We all had to go home, and transportation wasn't taking people anywhere because nobody was going anywhere. Well, we learned how socially isolated folks were. So our transportation department, since they weren't running the vans, they got on the phones and worked the phones and started calling all their clients, checking in. And out of this grew a volunteer-based program called Real Friends. And we match volunteers with individuals who are interested in having a phone call. It might be once a week, might be 3 times a week, whatever the need is. And they call and check in on each other and chat. It's really, really neat. We do some social enterprise. Even though we're a non-for-profit, we can do programs that, if we make any profit, go to supplement the other programs. So we do fee for service to supplement our other programs. We do 2 that are related to food, and they both support our Meals on Wheels program. One is called the Real Grill, and that is our food truck. Our food truck goes to events like some of the vendor fairs that I'm going to this summer. The food truck will be at. They cater weddings. They also offer a catering service called Simply Catering to You, and that's a full service catering company, and you're supporting Meals on Wheels when you support Simply Catering to You. So it's a win-win for everybody. Simply Catering has made my Thanksgiving meal 2 years in a row. So all I had to do was reheat, and it was a beautiful thing. And I fed a lot of people for a really reasonable price. They are a blessing. So if you've got an event coming up, you might consider contacting Simply Catering. They're on our website. There's a couple of additional programs I want to talk about. When Pam read my biography, she mentioned adult guardianship, and that's my favorite program that Real Services offers. I was the director of guardianship a few years ago, and I left that to run the resource center. They provide legal guardianship of the person and estate for individuals age 60 or better who are mentally incapacitated. They're incapacitated due to the effects of dementia, or they've had a stroke, they have Huntington's disease, Parkinsonian dementia, any medical reason that caused dementia. We can serve them, and we have them in 4 of our counties: Kosciuszko, Marshall, Elkhart, and St. Joseph County. We serve people who have no one else. They have no friends or family who are able, appropriate, and willing to serve in this capacity. We work with trust officers, attorneys, clergy, anyone that you would want on your interdisciplinary team to make decisions on your behalf. We've got that covered on our advisory council. So they receive referrals mostly from nursing facilities and hospitals, and some from Adult Protective Services. We present all of the referrals to the advisory council, and the advisory council tells the program which order to serve people in, usually based on needs and acuity. And like I said, we petition the court, and we become ordered the permanent guardian of their person and estate. So we make all of their financial decisions, manage their finances. Usually people in this program have very little by way of finances. They're Medicaid recipients and get Social Security income, and we pay their nursing home bill or their assisted living rent. And with their little petty pocket cash that they get to keep after they pay their expenses for the month, we make sure that they have their favorite things. So it might be red lipstick, it might be Diet Pepsi, whatever it is that's important to them, we make sure that they have. So it's a really special program. Then I already talked about the Aging and Disability Resource Center because it's my favorite. I said guardianship was my favorite. It's my second favorite because that's where I live now. I wanted to touch on energy assistance and weatherization. Energy assistance helps income eligible households with their heating expenses during the winter months. They serve a slightly different counties than the Area Agency on Aging. They serve Elkhart, Fulton, Kosciuszko, Marshall County, and St. Joseph County. And we have crisis money sometimes where we can provide assistance in emergency situations. So this is a huge program. They approve tens of thousands of applications for energy assistance. So people are relying on this to get their bills paid in the winter. And then weatherization is an offshoot of energy assistance. When someone applies for energy assistance, or well, when they apply, they mark on the application if they're interested in home weatherization. And there's a formula, a very specific way they go about who they're going to serve. But they go to home weatherization, goes to a home and assesses it, determines if they meet the criteria for their home to be weatherized, and provides whatever appliances or insulation that is needed to make that home more energy efficient. And then that helps with the person's energy usage and reduces their bill. And so then the energy assistance program is paying less for their bill. So it's a win-win. Next is Alzheimer's and Dementia Services of Northern Indiana, and they also have the Institute for Excellence in Memory Care. In my bio, it was mentioned that I'm a certified memory care professional, and that was through the Institute for Excellence in Memory Care. The Institute serves professionals. So there's the certified memory care professional, and then the qualified memory care professional is one step up from that. That is an intensive 3 days of training for the one that I earned, with a lot of tests, a lot of quizzes, and a lot of continuing education to make sure that I stay sharp on serving individuals with dementias. And then the neat thing about the Alzheimer's and Dementia Services of Northern Indiana is we are focused on serving caregivers who are local here now. So we don't do research, we serve caregivers. We do support groups, we do education. We have offices located at the Milton Adult Day Center. Day services for dementia individuals are, think of like a daycare, but with appropriate programming for an individual with dementia. And people go like 3 times a week for 5 hours a day, and it gives respite to their caregiver. Their caregiver can also utilize the library that Real Services has there, can also reserve a room where they can take a nap because caregivers need a nap, or they can read or cross stitch or whatever their hobby is, whatever's going to give them respite. Then that's what we want to support. And I really wanted to talk about volunteerism. Volunteers make our work possible. There's only 250 employees at Real Services and over 30 major programs. And so we need volunteers to keep chugging along. There's some pictures here. One is from the Alzheimer's walk, where we do a fundraising walk to raise money to support local caregivers now. This gal represents our Real Friends phone reassurance program. I talked about Real Friends and how that is helping with social isolation. We have volunteer services, volunteers who go shovel or rake, paint, things like that. And then this volunteer delivering the meals from Meals on Wheels to this gal in the cute pink. Love her. So there's a QR code if you're good with that. If you're not good with that, just call me. I'll get you connected with our volunteer services director. So I wanted to end with a personal story of how I got connected with Real Services. I was 6 years old when I first volunteered for Real Services, and of course didn't even know it. But I lived in Mentone, Indiana, that's in Kosciuszko County, and it's a very small farming town. And we had a nutrition site. The gal who ran the nutrition site, who worked for Real Services, went to our church, and my parents would volunteer there. My dad might give the devotional, my mom would play the piano, and they would drag us kids along, and we would play games with the grandpas and the grandmas. There was a grandpa who would give us pennies. You can't beat that. But we would play Uno and Skippo and dominoes with the attendees of the program, and we would do entertainment too. We might play piano or flute or sing. And when I was old enough to really volunteer, then I got put on the schedule to serve the meals a couple times a summer and really enjoyed doing that. So then fast forward to when I'm 30 years old and looking for a job change, Real Services came to mind, and I came in here as a care manager and just did that gig for a little while, and then eventually started leading programs. And so I'm so grateful to be a part of this program, to be a part of this agency. I think I'm going to be a lifer. I have 40 years to go. We'll see. I'm already planning retirement. But with just 40 years, I think I'll make it. So thank you for your attention, and thank you for your interest in learning about Real Services.
Well, Julie, thank you so much. I had no idea that Real Services did all this stuff.
It's
We
good
do have
stuff.
yeah, and how do people out in the community know about all this stuff so much? I mean, they don't know, do they? Am I
Oh,
the only
that's
one who doesn't know?
no, you're not the only one. Sometimes we think we're the best kept secret, but we try with billboards and social media, mailers, and those kinds of things. We try to get the word out.
Okay, we do have a few questions. Sarah asked, well, most of them are my questions, I guess.
Okay.
I had a bunch of questions. Sarah said, post-COVID, have you seen big change in the number of people wanting to age at home? And how is that affecting your ability to provide support and funding passed through from OAA and the state?
Yes, we have seen an increase in people who want to age at home versus go to the nursing home. We all understand why. And so we've had to make adjustments, doing a lot of hiring to have enough care management staff to keep up with the demand. And the Medicaid waiver program is unlimited right now. The slots are unlimited, and they have been the whole 9 years that I've worked at Real Services. And so we're able to serve all the people who want to age at home or age in a participating assisted living versus going to a nursing home. We always expend our Older Americans Act money fast, but that waiver money is always available.
Okay. Gordon had asked, are there similar services in Elkhart and other counties? Are all these
Yes.
services available in Elkhart County?
Yes. Yes, they might not be through real services. Like, for example, transportation, we send money to the Elkhart Council on Aging for them to provide transportation. So it's not real services providing it, but it's our funding being channeled through.
Okay. When people have the home care, are they paying for that? Or how, and first of all, does a doctor have to give a script for somebody to get the home care?
That's a great question. We used to get doctor's signatures for home care and we don't anymore. It's just based on the person's attestation of what their difficulties are.
Okay.
And I think I missed the first part of the question.
Oh, whether they pay for that themselves.
Oh, they pay for it. Okay, so somebody who can privately pay for their services, we would provide them with a list of all the agencies that accept private pay.
Okay.
And they could call and make arrangements. Private pay costs, like they liked the service to be a bundle of at least 3 hours, and that comes to around $60, so around $20 an hour for private pay. And then for the services I was talking about, the home care, Medicaid or the Older Americans Act, Social Services Block Grant or Choice is paying for the home care. The individual is not paying for the home care,
but you have
except
to
for through
qualify.
taxes.
But you have to qualify.
You have to qualify.
Yeah. When you have Meals on Wheels, who prepares these meals?
We have a kitchen that's right next to our main office on Michigan in South Bend. And so Real Services employees prepare these meals. They start very early in the morning.
Oh my gosh. Okay. And here's somebody, Brenda is saying, thank you for doing this Zoom to help me. How can I sign up for services? And I desperately need energy assistance and would love to be a foster grandparent. I'm struggling living on Social Security and need help. Medicare insurance agent was more interested in eliminating services than helping me get services.
Oh, heavens.
And I hear there is a Visa card for OTC drugs I never received.
Yeah,
Or waiver requirements. Yeah.
Okay. Sometimes the Medicare Advantage plans do have those over-the-counter, that benefit of a Visa card for over-the-counter medications and supplies, and that you would contact your insurance company about. I'm going to put my email address and my phone number in the chat, and you can contact me about all the things that you're interested in.
Wonderful. Thank you. And then Judy said, has the pay for professional caregivers gone up lately? When I worked at Real Services from 1999 to 2005, we had a problem with high turnover and caregivers not showing up or being highly unmotivated, and the pay was abysmal.
Oh my. There was legislation to increase the pay for the direct services, for not necessarily our waiver, but the waivers for intellectual disabilities and developmental disabilities. And by increasing the direct service providers' pay, it made it competitive. So it increased the pay for the service providers that we use. There's still going to be the problem of people being unmotivated or just not doing a good job. I'm sure that that's never going to go away, but there are some really, really good caregivers out there.
Oh yeah, yeah. But when I was in charge of a cadre of home health aides, people, somebody's card break down and they wouldn't get there, and then I'd have to go pick them up to take them to the place to go. And there were lots of those kinds of things that happened because they also were in need of some services, some of them. How is Real Services funded? Says Barbara.
State and federal. So it's taxpayer money. State, federal, and donations.
And where are you located Oh, you did say, but if you could say it again, or maybe put the address. Where are you located
Yeah.
on Michigan?
Sure. 1151 South Michigan Street. So we're across the street from Ivy Tech and the fire station.
And what does real services mean? I mean, what were the REAL?
Yeah, where did that come? Okay,
Yeah.
resource it is an acronym that our founder developed in 66. The Studebaker plant closed, and Mr. Lester Fox was the union master there, and he was asked to start a company that would retrain adults to do different work since they couldn't work at the Studebaker plant anymore. So he developed this acronym called Resources for Enriching Adult Life.
Oh, wonderful.
Mhm.
I don't know if there are more questions. I've answered all that I saw on here. I do have one other thing to say, though. One thing that was forgotten. Don't forget our new member party at 7:00 on the 9th at O'Rourke's on Eddy Street in Eddy Street Commons. Veteran members are encouraged to attend. Your first drink is free. And that's it. Does anybody have any other questions that they have for Julie? Yes, Jill.
I just wanted to say, I put this in the chat, but
Yes.
that my brother-in-law receives Meals on Wheels. He's disabled, lives alone, and he gets 2 meals a day, Monday through Friday. And it's just been a lifesaver. And we really, really appreciate that.
Oh, that's wonderful.
And I think Janet is the head of the, and
Mhm.
she's wonderful, just wonderful to work with too.
Oh, good.
I'm sorry, Jill. I did see that, and then I left it out. Sorry. Yes, Beth. Beth froze.
Just one little, oops, can you hear me now?
Kind
Can you
of
hear me?
now. Yeah.
All right, I'll put it in the chat. I'll put it in the chat.
Oh, okay. Julie, this is just amazing. And are you guys far from, I know that when I'm a CASA, and when we had folks who the family needed your services, and they had a hard time getting to your office. Are you close to the bus terminal, a place where the bus can drop folks off?
Yes, so that main office on Michigan is across the street from a bus stop that's
Okay.
in front of the Juvenile Justice Center.
Okay.
I have a question about Meals on Wheels. If you volunteer, is it like once a week? Is it, how is that set up?
It's whatever frequency you're able to do. I think once a week is the preferred.
Okay. And Beth, her question is One Roof Southeast Neighborhood Center. Please speak about
Yes.
that.
Yes, so that is one of 4 neighborhood centers that are going up. One Roof is open. They have, under one roof, they have Head Start, and they have Bowen Center for community mental health providers. They have a pharmacy. They have a real services office where our community action professionals work out of. There's always someone from community action there. And I'm probably forgetting some of the other services because it's just an amazing, there's a computer lab. There's always, the coffee's always on. People can pop in and get a cup of coffee and find out what services are available. But it's intended to be a one-stop shop for that neighborhood, and they don't check zip codes when you come to the door. So people from other neighborhoods are welcomed there too.
Wonderful. Okay, well, it looks like everybody in the whole world needs to know more about you guys because it's touching on so many of us. And some of those classes like the balancing, and I think I could do that. I mean, a lot of folks need those services that are able. Can people have services like that are able?
Yes, yes.
Mhm.
Looks like Barbara has a question.
I just wondered, what is the address of the One Roof South Neighborhood Center?
Oh, I think I can Google that real quick.
Oh,
And also Beth North says they have a community navigator to help also.
Oh, that's incredible. They're on Dubai. It's a beautiful new facility. They were given the little slice of land from the city, and then donors built the facility.
It's
They
right
have-
at the corner of Duville and Fellows.
okay,
Thank you.
thank you.
Okay. Julie, thank you so much. And before we go, next month, the second Friday, Lunch with the League, Maureen Bauer is going to be our speaker to tell us about how this legislative session down in Indianapolis has gone. So come back and join us. Judy,
And I'm assuming that everybody knows that she is a state representative in the legislature.
Okay.
they do now.
Mhm.
Also, Judy Bradford said we have 18 new voters at that Southeast Center during a voter registration event there. They got 18 new voters.
Mm.
So it's a good deal. Yeah. Without any further questions or comments, except for people that are saying, thank you very much, Julie.
Thank you.
Thank you very much, Julie. And thank you, everybody, for coming. It has been a wonderful hour. And now go out and enjoy the outdoors. And we'll see you all next month. Thanks a lot.
Thank you.
Uh-huh.
Bye-bye.
Bye-bye.